Good morning, folks. Cherry here for Sedona Surgical Services. As always, you guys, finally, we've gotten some news on Jackie O. Those of you guys that don't know Jackie O, unfortunately, was an influencer, a model, a mother, a sister, a friend, and she was somebody who had plastic surgery a few months ago and unfortunately passed away immediately after her surgery. And when I say immediately after, I mean within the hours after her surgery. I don't mean days or weeks, and I definitely don't mean during the surgery. But we received some news yesterday, so let's tune in. So yesterday, Hollywood Unlocked reported that Jackie O, the longtime partner of Wild 'N Out star DC Young Fly, died from complications of cosmetic surgery, according to the Miami-Dade County Medical Examiner's autopsy report. The manner of the death was ruled an accident. The report obtained by Page Six Friday details that she had gone for a gluteal augmentation procedure on May 30th, during which there were 0 complications. So you guys, she went for surgery for a BBL on May 30th, and there were no complications during her procedure. Now, as a side note, where Jackie O had her surgery, they only kept her for 2 hours after her surgery before discharging her into the street, into her own care, right? So she was prescribed various medications upon discharge, such as ciprofloxacin, aka Cipro, an antibiotic that every patient should have after surgery. I mean, it's important. You need to try to avoid infection. You've just had an intervention. First thing, oxycodone, which is a painkiller. Here in the Dominican Republic, we don't give opioid medications for pain, but neither here nor there. That's the painkiller that they gave her. And ondansetron, which is an anti-nausea medication that typically is marketed as Zofran, or a medication that's given to cancer patients or given to surgical patients after an intervention to help you not throw up. Now, it's also being said that Jacqueline Smith, which was Jackie O's real name, then developed an unrelenting headache and was advised to take ibuprofen and to stop taking the ondansetron. But that was told to her by a nurse. And we're not told if it was a nurse at the clinic or if it was the nurse that was taking care of her or if she had somebody with her. It's not being specified. Just a side note, I don't care how independent you are. I don't care how many years of nursing you have, etc., etc. If you have surgery under my care, my coordination, or anything like that, and you think that you're not going to get the right type of care in the immediate hours after your surgery, I'm signing off. There's no reason why after 2 hours you should be disconnected from medical care. The only thing that's being said, though, is that Jackie O's aunt was the one that called emergency services or called 911 for somebody to come to her, and by the time they got to her, she was not responsive. The TV personality was pronounced dead when she got to the hospital, and she was only 33 years old. You guys, this is really, really sad, and I'm really disappointed, but I want to bring some light to this case. Whenever one of our sisters passes away through one of these processes, we have a responsibility to bring light to the case, to make sure that we get justice for the family. And not only that, but to make sure that we educate other girls so that this situation, unfortunately, doesn't happen again. We can't do anything for Jackie O in that moment, but we can make sure that Jackie O's name and legacy lives on in other girls, as well as all the other patients who remain unnamed. You guys, this is a perfect example of why it is so important for you to have the right type of care and to be in the right type of facility immediately after your surgery. I know that people are not super huge fans of recovery homes and things like that, and that's okay, but you really owe it to yourself to at least stay in a recovery home the first 5 days, where you are going to at least stabilize yourself and know that you're out of harm's way. Being in a hotel, being in an Airbnb, being with a family member who doesn't have access to medical care, to an ambulance, who doesn't have access to getting you an immediate IV put in or any type of emergency service is not where you want to be for your immediate recovery time, especially when you're in a country where if you call 911, an ambulance is not coming right away. Where if you're in a... Do you know that if you come here, you need an ambulance, they may not come in 10-15 minutes. It doesn't work that way. So if you're coming here for surgery, please make sure that you put yourself in the right place. That's why we have them. That's why they exist, to keep you safe, to avoid these types of things. Okay? And if you need me, as always, you can count on a no death, no malpractice roster you can trust for the safest and the best quality care at the best prices, and always honest advocacy. With that, I'm going to let you go because it's my Saturday morning and I'm going to go back to sleep. Morning.